I'm Natasha Tracy from Breaking Bipolar here at HealthyPlace.com. So when people are first diagnosed with bipolar disorder, there's a hunt for medication. Some people are very lucky and the first medication that they take works, and that's wonderful. But for most of us, there's actually months and sometimes even years of medication searching to get to a place where we're actually effectively treated. I call this the miracle medication phase. I had one. I had a medication that was a miracle for me, and I think many people do. But the question is, what happens after this miracle medication? So there's bad news. And the bad news is that feeling, that miracle of that medication tends not to last forever. That miracle tends to wear off. It might wear off in a month or a year or 5 years or 10 years. But what happens is people develop tolerance to the medication. And this seems to happen at random intervals. We can't really explain it. But for some reason, the medication just stops working for people. And when this happens, it feels like a failure, like a disappointment, like you've done something wrong. But what we know is that this just happens to people. There have been studies on it. And this tolerance that happens is a physiological thing in nature and isn't necessarily indicative of anything that the patient has or has not done correctly. But I do want to say that there is hope even after a miracle medication fails. And that is that there are other treatments out there and other treatments are effective. I know. I spent absolutely years being magnificently ill. And somehow I was still able to find another miracle medication or combination of medications. So it does happen. So after that miracle medication, there may be a time when medications don't work for you, but that doesn't mean you should give up hope because treatment still works, but you have to keep at it. My name is Natasha Tracy, and this is Breaking Bipolar.